In the meantime, though, it's time for today's perspective, and it's all about a One Health approach. Now, that means that human health, animal health and ecosystem health are closely interdependent. But how do we ensure that that works for us in the future? Well, that is the issue as health experts from across the planet are gathering this week in Lyon in central southern France, the One Health Summit as part of France's presidency of the G7. Well, joining us now is Professor of Medicine and CEO of Paris Santé Campus, Antoine Tesnière. Thanks very much for joining us on the programme and being with us on the programme today. What do you see then from your perspective as the aim and the needs, if you like, of this summit?
Well, this summit is about one very central idea. We can no longer treat human health, animal health, and environmental health separately. One Health Summit is about connecting these systems to better prevent global health crisis. And we have a number of lessons taught from the past, from emerging infectious diseases or recent pandemics, for example, COVID, of course, that we need to move on the collaboration around these all three ecosystems.
So how do we do that then?
Well, it's essential to bridge worlds, not only geopolitically, but also technically from the animal health world, the human health world, and the environmental health. And one way of doing so is using data and artificial intelligence. And it's true that during the last pandemic, it's been fantastic to see how the use of digital tools and powered by data has been detrimental in fighting the epidemic, not only understanding its progression, but also designing new treatments and designing appropriate response to the COVID spreading around the world.
So how can that be done? I mean, it's good to hear for once that actually some of these technological advances can be useful. There's been a lot of criticism, of course, notably of artificial intelligence that you mentioned there. But in this way, you think artificial intelligence can be used in a very positive way?
Yes, absolutely. And it helps us to answer some of the underperformance that we actually face today. We see that a number of systems are actually fragmented, and we need to move on from silos to more coordinated work around these all three elements. We need also to adapt not only a reactive mindset, which was the case during the last pandemic, but more anticipated mindsets. And we need also to understand with the data and the digital tools more of the complexity of these features for emerging infectious disease coming from the animal world or the impact of environmental health. It's absolutely essential because the next pandemics will not be fought in the hospital, but more in anticipated way. And clearly, what we have seen with the COVID was kind of a wake-up call, showing how much these ecosystems are very interconnected.
And of course, you mentioned coronavirus a couple of times. You actually led the team trying to get France through the pandemic. I mean, do you think some of those technologies, notably artificial intelligence, could have been really helpful to you at that time?
Yes, absolutely. And so the tools we had about collecting data was really crucial to understand the progression of the epidemic and to design the appropriate handling response to every region and department in France, but it's true globally. And it was absolutely interesting to see the progression that were made using the initial data on the virus and fueling the pandemic simulation from the start. And the progression we did after a few months of experience, allowing us to go into very appropriate and very much detailed simulation, understanding the impact of such and such measure, such as confinement, vaccination, but also schools opening, etc. So these were absolutely essential tools to get a precise understanding not only of the progression of the epidemic, but the way we could fight it. And it's really interesting to understand that if you combine data from the animal world, if you combine data from the health, human health world, as well as the environmental world, you can actually get into a much more anticipated approach about the pandemic. But this also, of course, requires a number of geopolitical agreements, since we now work globally, and also the COVID was a very interesting example to understand that some of the variants of the virus actually came from different countries, and urging for the need to get international collaboration to fight globally the virus.
And do you think those tools could actually have saved lives?
Yes, absolutely. Absolutely. It's clear that, and it's not about tens of lives, it's thousands and millions of lives. And this is why this summit in Lyon is a crucial challenge, not only because we need to align most of the governments to move on from short-term economic or political concern over long-term health risks, but because also we need researchers in every world, the human, the animal, and the environmental world, to collaborate together to create an appropriate framework of collaboration about this One Health concept.
It sounds like a great idea, the summit, getting everyone together to talk about it. How do you ensure, and how do your colleagues ensure, that it's not just a talking shop, that it's not just lots of people who talk about an idea, but actually nothing really concrete comes out of it at the end of it?
Right. Well, so we have a number of existing collaboration. We have scientific networks around the world, epidemiologic surveillance, for example, not only in Europe, but to a larger extent globally. And we have a number of international organizations, such as the World Health Organization. So every level of collaboration is essential, not only the scientific, but also the political. And at the end, the political level also helps to get the political drive and the appropriate funding, because the collaboration requires a number of funding to be efficient. So we need to define clear objectives, and again, some of the very important objectives beyond breaking silos and moving to a scale-up prevention initiative is really to create coherent surveillance tools based on data from all over the world. And this can be only achieved with political will happening into these summits.
Yeah, you mentioned political will. I mean, that's crucial as well, isn't it? I mean, here in France, a lot of what you're talking about are issues that people talk about in a positive and a constructive way. There are countries around the world which don't believe in a lot of the kind of aspects that you're talking about. How do you get other countries to become involved and do their bit as well?
Well, sharing scientific evidence, to me, is a crucial step to align scientific from all over the world. And again, from the infectious disease surveillance system, not only the ICDC from the US, but there's also an ECDC from Europe. You can gather data showing the important need to work more together. Also understanding that helping all the countries to get inappropriate prevention strategies will not only help these countries, but also will prevent other countries. If you think of COVID-19 variants, for example, it's not only about vaccinating one whole country, it's making sure that the whole world, because every country are globally interconnected, can actually get protected to prevent further aggravation.
Antoine Tesnière, thanks very much for being with us on the programme today. Antoine Tesnière joining us there, Professor of Medicine and CEO at Paris Santé Campus. Thanks very much.